This vaccine is exciting because I believe this is the weapon that will end the war. It's the beginning of the last chapter of the book, but now we just have to do it. Vaccine doesn't work if it's in the vial, right? So New York State has been working very hard to deploy it, to get it out. We have trains, planes, and automobiles moving this all over the state right now. We want to get it deployed, and we want to get it deployed quickly. And we're here to watch you take the first shot. So, Michael Dowling, Dr. Chester, Sandra Lindsay, we're all with you.
Governor, thank you so much. And let me also express our thanks to you for your extraordinary leadership during this whole pandemic over the last number of months, and obviously today. And the fact that you committed to science and data to guide your leadership is absolutely extraordinary. And as you said, we're in Eastern Queens. And as you know, Queens was the epicenter of the COVID issue back a number of months ago. This is where it hit the hardest. And this facility, Long Island Jewish, was right at the center. And here at Northwell, we've seen well over 100,000 COVID patients. And at one point back in April, we had over 3,500 patients in our hospitals. And as you said, we are the largest health system in New York, and we are very, very proud of our frontline staff, and of course of the frontline staff of all of the hospitals and all of the facilities across the region did spectacular work, and as you said, they are the real heroes. So it's a pleasure to be here with Sandra and Dr. Chester, and I don't think we need to delay any further because this is a special moment, a special day. This is what everybody has been waiting for, to be able to give the vaccine and to hopefully see this is the beginning of the end of the COVID issue. But I just would like to say something, though, that just because we're giving out the vaccine is no excuse for the public out there not to continue wearing masks, not to social distance, etc. You have to continue to comply with safety standards, even though the vaccine is going to be distributed over the next couple of months. You have to do both if we're going to be successful here, as you know very well. So again, Governor, we thank you. Thank you for your extraordinary leadership. And with that, let me turn it over to Dr. Chester, and then with Sandra here. Sandra is a critical care nurse, has been on the front lines all during the crisis, is a director in critical care. She has seen a lot, and she's very, very happy to be here to receive the vaccine. And Dr. Chester is a director of our employee health services. So with that, Dr. Chester, we'll turn it over to you.
Thank you. How are you feeling today? I'm feeling great. Yeah. Okay, so we're going to the next rotor.
So, Sandra, you didn't flinch. I take it that Dr. Chester has a good touch.
She has a good touch, and it didn't feel any different from taking any other vaccine.
Great. Dr. Chester, it all worked, the kit from your end?
Everything worked perfectly, thank you.
And you're feeling well?
Governor Cuomo, I'm feeling well. I would like to thank all the frontline workers, all my colleagues who've been doing a yeoman's job to fight this pandemic all over the world. I am hopeful, I feel hopeful today, relieved. I feel like healing is coming. I hope this marks the beginning to the end of a very painful time in our history. I want to instill public confidence that the vaccine is safe. We're in a pandemic, and so we all need to do our part to put an end to the pandemic and to not give up so soon. There's light at the end of the tunnel, but we still need to continue to wear our masks, to social distance. I believe in science. As a nurse, my practice is guided by science, and so I trust science. What I don't trust is that if I contract COVID, I don't know how it will impact me or those who I come in contact with. So I encourage everyone to take the vaccine.
So you said it very well, Sandra. We trust science here in the state of New York. Federal government approved the vaccine. We then had New York State have a separate panel that also approved the vaccine. And we've been following the science all along. I hope this gives you and the healthcare workers who are battling this every day a sense of security and safety and a little more confidence in doing your job once the second vaccine has been administered. In New York, we prioritized healthcare workers at the top of the list to receive the vaccine because we know that you are out there every day putting your lives in danger for the rest of us. So we want to make sure we're doing everything we can to keep you safe. And the point about New Yorkers and Americans having to do their part and take the vaccine, because the vaccine only works if the American people take it. They estimate we need 75% to 85% of Americans to take the vaccine for it to be effective. So every American has to do their part. And your point is right. It's going to take months before the vaccine hits critical mass. So this is the light at the end of the tunnel, but it's a long tunnel. And we need people to continue to do the right thing and the smart thing all through the holiday season. Hopefully when we get to about June, they estimate the vaccine can hit critical mass. But the healthcare workers will get it first because we know that you're super stressed during this holiday season. So God bless you. I want to thank you from the bottom of our hearts for what you do. Everybody knows it. Everybody knows how brave you are and skilled and talented and selfless. When they use the word heroes, we don't mean that lightly. We mean it deeply and sincerely. What you do, showing up every day, you really are heroes. And we wish you and your families a blessed holiday season. Michael Downs, thank you very much for your leadership once again, my friend.
Yeah, thank you, Gov, and we will beat this. We will win.
Thank you. When my time comes, I want Dr. Chester. I like her style.
No problem.
I want to be there to see it.
Yeah. Thank you, guys. Thank you very much.
Thank you, Gov.